Hello, welcome to our presentation. I am Camille Skubik-Poplaski, and I have the pleasure of introducing Carson Elliott, who is part of my research team, and she is going to share with you our results of our study. There you go, Carson.
So as Camille said, my name is Carson Elliott. The title of this case study is IGNITE, which stands for Improving Hand Recovery with Neuromodulation and Tetraplegia. So IGNITE is an ongoing study, but we looked at using transcranial direct current stimulation, which I will continue to refer to as TDCS during this presentation, and you can see a picture of it here in Figure 1. And combining TDCS with occupational therapy practice and looking at how that affects motor recovery and quality of life after a spinal cord injury. So the occupational therapy practice in this study was using intensive task-specific motor training, and combining that with the motor training in the TDCS focuses on neuroplasticity or rewiring of the brain. So to talk about the IGNITE trial a little bit more, it's a mixed methods, double-blinded, randomized control trial. The participants were split into an active TDCS group or a sham TDCS group. And each group received 24 motor training sessions and 4 assessment sessions. So this case study focuses on a participant from the IGNITE trial. We will refer to her as Maggie. She has a chronic C6 incomplete spinal cord injury. And the assessment measures used were qualitative and quantitative, but one measure I wanted to highlight was the Canadian Occupational Performance Measure. This allows us to get client-centered goals so we can tailor those motor training sessions to things that she wants to work on. So we did things like managing pill containers, using makeup and fingernail polish, and playing checkers. So that brings us to the results. For the quantitative results, we saw a trend. She was able to make gains or maintain her baseline scores, but at the 4-month follow-up, she starts to decrease. And the 4-month follow-up is when she leaves the clinic. So this decrease holds true for her scores in self-care and mobility, for the spinal cord independence measures, which can be seen here in Table 1. It also holds true for her strength, which we assess that by manual muscle testing and the grasp strength subtest, which are in Table 3 and Table 7. It also holds true for her grasping performance here in Table 6. To go back to the COPM, it looks at how someone views their performance and their satisfaction with their performance. And in the 4-month follow-up, Maggie's satisfaction scores dropped dramatically. So that brings us into the qualitative results. We found 3 themes, and those themes were evolving meaningful roles to enhance quality of life, increased confidence leads to more doing, and linking identity to occupation. So for that first theme, she felt she was a more helpful spouse. She was able to complete more of her self-care. She was able to help more with home management and to help more with her transfers. For that second theme, she was more motivated and confident due to her autonomy. And for that third theme, she felt she was able to do more with her hands than she had since her injury, so this far exceeded her expectations of what she thought she was going to get from the trial. So that brings us to the discussion. Since this is an ongoing trial, we can't release Maggie's TDCS status, but one thing we can talk about is that her motor scores and her mental gains, they did increase, which shows that using the motor training principles can increase hand function. And for Maggie, regardless of when the injury occurred, she's been living with her spinal cord injury for 10 years, and she was still able to make gains. This also was a transformational experience for her. She felt she was able to do more of her valued roles and occupations. And to consider how this impacts occupational therapy, her scores start to drop off in the clinic, so occupational therapists should consider how can we keep those mental and functional gains up, and can we keep people in the clinic longer? And brings us down more for some clinical implications, that it just reiterates that motor training does increase hand function and has positive outcomes for neuroreeducation. And also that TDCS is still in the research phase, but occupational therapists should seek out relationships with researchers to continue building the body of knowledge around this so that we can start bringing it in the clinic. So that brings us to the end of the presentation. I'd like to thank the College of Health Sciences, my faculty advisors, and the Ignite investigators and my peers for all the support and efforts that have gone into the case study. And I'd like to thank all of you for tuning in to watch my presentation.